Hello, everyone, and welcome to our open news meeting. Thank you, everyone, for joining us. I realise we feel as though we're just at the beginnings of the first episode of the second series, that difficult second series of coronavirus. And so we've given this series a name, or at least this thinking today at lunchtime a name, which is the Corona Circus. And if you saw in the note that I sent round to all Tortoise members yesterday, we want to talk about the Corona Circus in this sense that it feels this week as though you're seeing the coincidence of 4 or 5 things at the same time. One is new data coming in on infections and deaths. 2 is the digestion within business and working families of whether or not Rishi Sunak's job support scheme will in fact support jobs and businesses. A real sense of bewilderment and frustration on university campuses, whether that's about support for people who've just arrived, the likelihood that they're going to be isolated over Christmas, and the question of refunds. The ongoing question about test and trace, and particularly the delivery of the app. And then 5th and finally, back in Westminster, what feels as though it's not just an ideological but deep political division over the government's decision to press ahead with new enforcement mechanisms without parliamentary scrutiny, and Sir Graham Brady, the head of the 1922 committee within the Conservative Party's push to get parliamentary scrutiny and dividing the Conservative Party in the process. So it feels as though we have a good deal to talk about. I'm going to start today by just, if you like, pressing one particular point, and I hope that in the course of the thinking you'll follow up with something similar. What I'm really hoping for today is to try and get as many new lines for us to think about in our meaningful coverage of what's happening in the coronavirus as possible. And by that I mean not necessarily answers, but questions that we should be pursuing. I'll give you one that's on my mind today. So I was looking at the latest numbers from the ONS, the Office of National Statistics, on coronavirus deaths and deaths more broadly in the UK. Right? And so, as I see Andrew Girdwood was just picking up, obviously there are different breakdowns, particularly between NHS England and Wales and deaths for the whole of the UK. But what is really striking is that the latest numbers show that the weekly deaths in the UK were at 9,523 for England and Wales, 10,784 for the UK overall, right? Now, in fact, what that shows is a slight increase in COVID-19 deaths, right? Significant overall, but not in significant given the scale of growth, but not in the overall percentage of those 10,000. But what is interesting is that the number of deaths is significantly higher, at least in a statistical sense, significantly higher than it would be in a rolling average of the last 5 years. So for England and Wales, weekly deaths are at a 2.8% degree higher than they were, UK-wide 2.3%. And then if you look at the breakdown of where people are dying, what's really striking is that although the numbers of people are dying overall has increased, actually fewer people are dying in care homes and hospitals. Many more people are dying at home. Many more people are dying at home. And it makes me think that is there an element here that we should be pursuing, which is the extent to which 6 months of the coronavirus has frightened people out of the care system, right? Whether it's care homes or hospitals, and what that might mean. And so I suppose I start this thinking in that spirit, which is let's try to understand what's happening here. I'm going to ask my colleague Matt D'Ancona to kick off just by giving us some insight into the headlines we're seeing, because I see that yesterday's headlines were dominated by arguments about red wall Tories versus Johnson and government Tories. And I wondered, Matt, whether you just try and give us some context for that, and I'm going to try and go through these different elements in the course of today's thinking. I think pretty much everyone, I hope, has been to a thinking. If you've not been before, the real element of it that's important for us is to hear from you, your point of expertise, your personal experience. So, flag your name up in the chat. My colleague Tom Goulding is controlling this thing from behind the scenes, and I'll ensure that Tom brings you in. But Matt, why don't you kick off and just give us, if you like, a primer on the politics of this?
Thanks, James. Well, the red wall is quite a good way into it, because it's quite a good symbol of lots of other things that are going on, and the problems the government's experiencing politically and with corona. So red wall obviously is Midlands, Yorkshire, parts of Northern England, that former Labour heartland seats that fell in 2019, and the Tories won net 48 extra seats in the 2019 election. And I was talking to a cabinet minister yesterday about the red wall business, and he made a very good point, which is that the situation the Tories are in the red wall is very similar to where Blair was in 1997, with all those Middle Britain seats he'd hoovered up in his landslide, which was they'd come over, they were interested, they were fed up in that case with the Tories, but it didn't mean that they were, the votes were on loan, so to speak, and Blair's job was to make sure that he secured them in 2001, which he did. So the task for this Conservative government is to make sure that they hold on to all those seats in the next election. And some of the majorities are quite healthy, 4,000 to 6,000 and more. So, it's not unreasonable, but there's no intrinsic reason why they're not safe seats. The Conservatives are on probation in these places. These are places that have, as it were, they've stopped obsessing about deindustrialization in the 80s. They're very pro-Brexit, which was obviously a huge force in the last election. They're socially more conservative than they are socially liberal, and they hated Corbyn. So those were the factors then. Factors now, they bought the Johnson rhetoric about levelling up, and they expect investment. They expect new jobs to be created in the areas that we're talking about. They hate, for example, HS2 because they regard it as a London scheme, not a scheme for them. And they have high and perhaps unrealizable expectations, especially now, of what is coming their way. Obviously, that then leads us nicely into Corona. One of the problems is that again, the areas that are now being disproportionately hit by lockdowns, by special restrictions, by curfews, and testing problems are in those areas. And this all now has sort of reached a head in the coronavirus bill, which is going to be voted on this week. And it's fascinating to compare the first vote on the coronavirus bill in March, which went through more or less on the nod. I mean, it's a sweeping bill. But I think it was only David Davis and a couple of others that inserted a sunset clause and a couple of modifications. But basically in March, it went straight through, a rubber stamp. This time, completely different. And it's quite a good emblem of how the mood has changed since March to September. A lot of Tory MPs very angry about it. And you have a curious coalition against the measures in the Act. So you have on the one hand, BLM, libertarian organizations, groups that are normally associated with social justice, the centre left, and then the new Red Tory MPs who are worried that this is going to disproportionately affect their constituents, and in particular is going to really have a chilling effect on any chance of economic recovery in the next 12 months. And it's interesting, Deborah Mattinson, the pollster, has just published a new book on the Red Wall. And one of the things she notes in that book from all her focus groups and surveys is that the mood in the Red Wall seats has changed. And it's changed during the pandemic. And interestingly, there's huge concern about the economy, which I think you'd probably expect. but also the Dominic Cummings affair, very rarely for a Westminster soap opera issue, cut through. And people were talking about it in pubs and clubs and her focus groups and so on. And that has it planted in the mind of the Red Wall voter the fear that this is just another elite.
Mm-hmm.
And so that's sort of where we are, and that kind of gives you quite a good image of the problem that Johnson now faces politically.
Matt, it's really interesting. It's so odd, this, because you have high incidence of corona in many of those seats. You've also got much greater economic vulnerability. And at the same time, you've got this weird combination of having been carried into your seat by Boris Johnson and the project. And at the same time, that loss of control as a parliamentary representative by the extension of executive power. It's one of these things, the closer I look at it, the less I understand of it.
Take back control to lose it.
Yeah, exactly. Exactly. I tell you what I'm going to do, if I can, I'd like to come back to you in a sec, because there are a few things I just want to pick up from the introduction, and then I do want to go to Kerry Thomas, because Kerry, I'd love to hear you fill in just some of your thoughts after last night's thinking on Can Boris Survive, which I know picks up on some of the points that Matt was making. But I saw that Deborah Cohen had made a point about this question on my mind, which is, are people deliberately and dangerously avoiding hospitals and care homes? I saw Claudia Williams, the brilliant author of our file this week on Big Egg and ProFam, was making this point about the difficult choice you have to make about admitting a loved one to hospital or into a care home. And I'm also really interested to pick up on Andrew and Girdwood and Lucy Huberman's points about apps and test and trace. So Deborah Cohen, can I just see, I don't know whether or not this was an observation or personal experience, this question about not being able to visit someone in hospital.
No, it was personal experience, actually. On Sunday, my mother-in-law fell at home, second fall in 4 days. We called an ambulance who wanted to take her to hospital. And it wasn't the only factor, but one of the questions she asked was, will there be any, can I be visited? This is to Northwick Park. And they said there's a no visiting policy. So that was kind of confirmed. She said she didn't want to go.
And she's fallen 4 times, did you say?
No, twice in 3 days. Yeah.
And, but
yeah.
What did the ambulance say out of interest when she said that? Did they say, look, it really would be safer for her to come to hospital, or they respected that decision?
No, they said, well, you're clearly a lady with capacity, and as long as you understand the risks of you not coming to hospital, and she said emphatically she did. They then made a joke and said, we don't go around kidnapping old ladies to take them to hospital, which was very sweet. And that was the end of the conversation, really.
And just out of interest, but you think that I know it's a ridiculous thing to ask, but if there weren't a pandemic at the moment, she would have been much happier to have gone to hospital, at least for tests? Or you think she would have said...
Yeah, I think so, because one of us would have gone with her in the ambulance and stayed with her.
Right.
And managed, and would have been there to say, can she now come home? Because this was only a situation for tests. I think she was worried that once you're in there, you can't get out and there's nobody to advocate for you.
Right. Okay. Deborah, thank you. Claudia, I'm just going to pick up, because it seems though you're making a point in a similar vein, if I've got it right, which is that difficulty of making that choice.
Yeah, so it was I mean, I'm running the chat, so it was a response to Zav, who also made the same point. But basically, yeah, it's such a difficult decision if you know that if someone is going into hospital and you think actually you might not be able to see them for an undetermined amount of time, that might influence the decision that you're making in terms of care. And obviously, in some instances, you don't have that choice. If someone needs certain medical care, they have to go to hospital or they have to go to a care home. But I do think that there are some people where there's a grey area of at what point do you decide that care is worth it. And I just think that there must be families at the moment who are making a really horrendous decision between saying, you know what, instead of this person going into hospital, we're going to keep them at home, even though we know that that might have an impact on the amount of time that they stay alive, but they're going to be with us in our family, and we're going to be able to see them. I guess that was my kind of.
Well, Claudia, thank you. And in the spirit of sort of addressing some of the stories that are being undercovered or perhaps only covered from a very narrow angle, I want to see if Renee Blow will join us, because Renee, you were making the point about what's happening for students. For what it's worth, we had a to and fro online on Sunday, Renee, about exactly this subject. Matt Dancona was saying, what is the real story of what students are feeling, and the frustration that's bubbling up. So will you give us your point of view on what's happening and the way in which we should look at this?
Well, it's not just about how they're feeling, but how they're being actually treated. So, for example, and I mean, I have to be careful. You don't want to call out or name and shame specific universities, because I'm pretty sure it's pretty bad. And I'm only talking about stuff that I've observed in Scotland. I know there's been a big problem down at MMU, Manchester Metropolitan, but apparently in Glasgow, the police were out at the Murano village and basically giving students absolute hell. Now, so that's very heavy-handed, and that happens all the time in Glasgow. Sorry, I've said that too forcefully. That's too bold.
Yeah.
But I mean, it's just that kind of thing has not been reported in the news. I mean, you see that thing where it had the students and it was like, please help send beer. Now, people show that. Did you see that sign?
No, what did it say?
It was a huge sign in a window saying, please help.
Oh, yes, I saw it.
Send beer. Right. So, I think that it's absolutely not being properly covered what the students are going through. I mean, I know a lot of students because they are my nephews and nieces and so on, at different parts of Scotland. Of course, Scotland's so much smaller, so much fewer universities. Everybody talks to everybody else about what's going on. So there's a lot of stuff that's absolutely no way is it being reported. And this, how Nicola Sturgeon has handled this, I think, could end up being her downfall, which would be absolutely a shame, because she's done such a good job, I think, with Corona. And now what the hell?
So Renee, I'm really interested in this. I thought that for the first time, in fact, I was listening to the radio at the end of last week. I think it was on Thursday, and I was thinking, this is the first time I've heard Scotland and the SNP government really in the crosshairs in a way in which for months and months and months it's been much more ministers in Westminster, and it clearly is that case. I don't know whether or not you think
Gary Garavelli wrote a piece for the Scotsman on Sunday basically saying, this is absolutely outrageous. The universities have lured students back. What was that all about? And she stands by it. She's had a lot of flack for it. I'm very interested to know what Steve Reicher, I don't know if you pay much attention to him. Steve Reicher, the guy from St Andrews, who's the advisor both to the Scottish government and the UK government. Do you know him?
No, I don't. But
don't you? I mean, every time you turn the news on, Steve's on it, right? So in any case, so Steve's a kind of like contact of mine. I mean, he's a world famous social psychologist, and he really has taken on Boris Johnson in a huge way. Anyway, he tweets under Stephen Reicher, and he's been on so many programs. He's on Channel 4 News practically every night of the week. And everybody's paying attention to what he says because he sounds as if he knows what he's talking about. That's because he does know what he's talking about. I mean, Steve, based on his theorizing, he covered the riots in St. Paul's in London in the 80s, and based on the work that he did then and subsequently since then, there's a whole social psychology about how do we handle people in crowds. So, I mean, he's constantly on giving information and telling the governments how they've gone wrong. I will be very interested. He's not criticised Nicola Sturgeon once, and I can't wait to see if he's going to do that.
Okay, well, I can see, by the way, it turns out that I'm the only person, it seems, on this call who doesn't know who Stephen Reicher is. As I can see, Lucy Huberman has just pointed out, my colleague Kerry Thomas has done. I'm gonna sort of divert from my plan, just because, Renee, just given what you said, it seems crazy not to pick up on Chris Cook. I don't know whether you saw, Chris wrote this absolutely searing piece. I don't know what it was, Chris, 2-3 months ago now, certainly early summer, warning. It was particularly focused, I think, on Gavin Williamson and the government about the scale of the problems that were about to hit the UK university sector. Everyone who knew anything about it said it was brilliant, and everyone else kind of quietly went on with their business. So now most of the things that you forecast, Chris, seem to be happening, but even more, even more in the sense of people going home and worries about health and worries about refunds and those questions. Chris, do you want to just sort of give us an update, if you like, on where you think, what are the problems facing the university sector now?
So I think when I wrote that piece, which was in May, I think, it was written on the assumption that we would by this point have an effective tracking and tracing system. So I think the prospect of universities refilling without the capacity for institutions to rapidly test undergraduates as they arrive and deal with that wasn't on the agenda. So in a sense, I've been caught out, if you like, by how badly that simple process has happened. One of the things that's odd about this is if you looked at the US universities start much earlier, and we had a warning about what could or couldn't happen. And what's very striking is that lots of the universities have had big outbreaks and had real trouble, and the ones that have succeeded have either been ones that are basically campus universities, of which I can't really actually think of one in Scotland. They're mostly urban universities in Scotland, in town centres. So if you go to Cornell, right, you go to basically a town in the middle of nowhere that's just a university. You're not going to spread it to anyone else who's not attached to the university because there's just no one else there. Whereas if you go to, a Scottish university, you're probably going to quite a substantial urban settlement as well as the university. And one of the lessons from there was that the capacity of the institutions to cope was partly linked to their sort of geographical size, but also their ability to put on their own testing programs, which lots of them do. Lots of them are insisting on the weekly tests. There was some extraordinary statistic that I think the University of Michigan system was commissioning something like 5% of all the tests in the US in 1 week. Because they had to know what was going on with their students, and we weren't prepared for anything like that scale. So I think that's where I've been caught out. I think the finances stuff is a slight red herring in Scotland, because actually in Scotland the universities are more secure for the most part than in England because they get a grant, right? And do we really believe the Scottish University is going to say you couldn't teach 3,000 of your students because of COVID? We're going to withdraw the funding for 3,000, right? Mm-hmm. They wouldn't do it. Whereas in England, the kid has to turn up before the money, the voucher is kind of issued. So the English universities are much more vulnerable just because of that sort of tedious, like bureaucratic thing. Can
I just ask you one thing, right? One sort of, do you think they should have said, actually, look, we're not going to reopen?
They should have gone for, there are two choices, right? So they should have they could have tried to move to January starting, right? That's one option. And that would have given them more time to prepare. But fundamentally, if they weren't planning to prepare a testing and tracing system for each institution, then they would have been where they are today in January, right? It's like a thing about bringing all these young people together from across the country is they will have the virus and there will be outbreaks. It's like, it's to open universities to have a policy of outbreaks. Right. What they could have done is effectively be going through a system now where we could have had a situation where we told people, turn up, there will be outbreaks, but we'll get a handle on it as quickly as possible and there'll be no face-to-face teaching for a bit. But you know what? You'll meet your new friends, you'll live in your new town, it'll be a bit open. It's not going to be like it was in like April. And being upfront with people would have been the right place to stay. I think the the awfulness of it is the turn up, you'll get face-to-face teaching, you'll get face-to-face teaching, you'll get face-to-face teaching, and then immediately they turn up, shut it all down.
So then I'm actually going to come to Lisa G on this point and to Daniel Dipper too, but Chris, just run us through, because when you did your original piece, one of the points was about the financial crisis coming to universities because so many foreign students weren't going to be coming, facilities weren't going to be used, the knock-on impacts on funding for research. Presumably you've got all of those problems, and now you've got a massive question about refunds.
So we've got, so we don't know about the financial stuff yet, right? So as you say, there may be a refunding issue about who will choose to drop out basically for this year. There's an issue around the fact we don't really know how many foreign students have turned up yet. So they can hold their places right up until the last minute and then decide, actually, you know what, I don't want to be locked in Manchester. You know, I don't fancy this. The structure of British universities is that basically the posher research intensives tend to go back a little bit later. So we don't know anything about some very large and important and some very large sort of institutions that are very research intensive who also have the most foreign students. So like we still in sort of slightly mysterious about what is actually going to happen. The thing that I did not foresee at all, or nor did any vice chancellor, was the fact that there would be a rise in British undergraduates this year. That's the thing that is sort of slightly mitigated.
That might save them economically. No,
it's like it is a band-aid, right? If you were in, it will mean that actually that's not fair. There are institutions who otherwise might not survive or would be really struggling who will be okay. The macro problem of the research intensives potentially being massively out of pocket, plus them having massively over-recruited British students who don't make them enough money to pay for themselves, is a sort of may create weird dynamics. It's totally possible, for example, that UCL, which is up by like 1,000 students this year at least, like a third on its normal intake because of the A-level fiasco, is going to lose money because it will lose a relatively small number of foreign students who pay a lot more per head. We run a foreign students in a deficit generally at the research intensives on home students, so you can't make up for a loss of a foreign student with more home students.
God. Okay, well, Kerry Thomas, our colleague, fellow editor Tortoise, has just put in the chat that 8% of Oxford University's money comes from undergraduate fees. Amazing, amazing how little that is. Tells you a lot about how misunderstood, or at least misunderstood by me, the economics of a university are. I'm just going to bring in Daniel Dipper. Daniel, I'm interested in your point because, Daniel, you say you're about to start university and are worried. I think I'm probably quite worried. So when are you due to start?
So I'm moving in on Friday to Oxford actually, and then freshers is next week.
So you head to Oxford on Friday.
Yep.
And is anyone saying to you, friends, family, a small voice in yourself that says, actually, maybe I shouldn't do that? Or what are you thinking?
Well, I mean, I have actually been in Oxford for 2 weeks last month. I was actually running the Opportunity Oxford Access programme, and actually that entire programme, apart from one lecture, was actually all in person, including all the lectures. There was 36 of us in the particular stream I was on, but they did manage to do everything face to face. And from what I know, nobody actually tested positive for COVID on the entire course, and it has stayed that way so far. So actually, fingers crossed, it stays that way. That actually went quite well overall. So that was reassuring in a sense, because I was quite worried before I went about that, particularly considering how everything was going to be face to face. But I mean, the Christmas story was incredibly concerning.
I think Daniel Gavin Williamson, who has been kind of conspicuous by his absence, has popped up in the comments to say
12:30 today. I watched the statement where he says that it will be able to happen. I mean, Oxford are actually better placed for something like that, because if they actually said it was mandatory for 2 weeks self-isolation, our term finishes on the 5th of December. So actually we could do it, and on the 19th we could actually come home, and actually that would work. But for other universities that have longer terms, of course, that's a bit more of a challenge. But I think with so many more people going there, and I mean, my college about to convert a lot of places that used to be lecture halls or access centres and stuff, they've actually had to convert a lot of it into accommodation because they've had to take on so many more students because of what has changed in terms of the grading fiasco this year. So there's actually going to be a lot higher density of students than they usually have. Plus with COVID and everything, that could be, that could be quite tricky. I mean, the scenes I've seen elsewhere are not reassuring. Though I'd hope that it'd be a bit more sensible.
Well, Dan, will you do us a favour? I mean, you may be caught up in the excitements of new university life, but next Tuesday on our Open News Thinking, if you can check in, it'd be really interesting to know what life is like as you in those first few days.
I think I'm going to be on either next week or the week after. I've got it in my calendar to try and come along. So
that'd be great. Okay, thank you. Lisa, can I just ask you a question? You just said that a colleague of yours, at least in the chat, Lisa G, said that someone had just said, look, the simple answer to this would have been to do the first term online.
Yeah, I mean, that was speaking to somebody who is a chief exec of an NHS trust and has a partner who is a professor at a university. And she was just like, look, we should just have all followed the London School of Hygiene and Tropical Medicine, who know about those sort of things, and just went straight away much earlier, first term will be online. And
that, I mean, I tell you, and we'll come to this in a bit, Lisa, because I think that something is happening here, which is, and you can understand how it does happen. You make a plan, you really work it through the course of August and early September, and then you enact that plan, right? But the world changes. I think that's what has happened in education, and I think it's what's happening on the job support scheme. I think this was a plan for a different time. But so you're going to say? Yeah, I'm just going to say, and at Birmingham, where I work, I don't actually do any teaching. I'm just do research there. But the communications that have come through have included. So, for example, last week, staff had to pivot from delivering face-to-face to delivering the lectures and tutorials they were going to do this week, the beginning of this week, between Friday and Monday. Right. So, I mean, it's constant change and people are really, really trying to adapt. And frankly, neither the teaching staff nor the students can win. Right. Yeah, it's really, I do understand that. I think, though, there's a question here about communicating uncertainty with a little bit more of a lead time. I'm going to stop today's call at 1:55 on the dot, so everyone's going to get a 5-minute reprieve from their plan, but it also means I'm going to rush through things a little bit faster than usual. I know there's been a lot of conversation about test and trace and the app. I want to loop all the way back round, if I might, to Andrew Girdwood, who sort of picked me up rightly on the fact I talked about the app, but there's a different England and Wales one from what's rolling out in Scotland. Andrew, do you want to just start this by what you think is or isn't working in Scotland on the app?
So I've, I guess, an interest to declare because I was part of the Scottish app team. Right. But having said that, this is not official commentary or anything like that. But we decided, or rather the government decided, not to reinvent the wheel. So we haven't spent a fraction of the money. And the app that we put together is basically an Irish app. It was already up and running, bug tested as it will on the Irish. And Northern Ireland then went for it, and then Scotland followed suit. But in fairness, the Scottish app is much simpler. You do not enter your symptoms. You don't get hotspot notifications, which I believe you get from the English and Welsh app. The Scottish app simply worries a great deal about your privacy, encrypts all the data so the government can't use it. There's been some comments in the chat about how the data is permanent and it could be used not with this app. But if you do get COVID, you get a code which you put into your app, and then that triggers the alerts. We need, like in England and Wales, we need enough people to download it. And a concern was when the English app suffered a rocky start, the commentary from the press was, the problems with the app. Right. And we were worried that you'd see a decline in use here in Scotland because the distinction wasn't made. And I totally understand why it wouldn't be made, because it's a complication. You don't really need to make the distinction if you're just telling the story of the rocky launch of the NHS app, but it was possibly a weakness in the strategy of having apps for different regions in the UK.
And Andrew, will you just give us a minute's talk through of the sort of Tim Cook at Apple, Google announcements of how big tech was going to weigh in, then the back and forth in England, the establishment of different apps in the nations, and where we are now?
Yes, that's right. So there was a big debate at the start of the outbreak about whether to centralize the data or to distribute it across the apps. Governments across Europe flip-flopped on this. Relatively quickly, Google and Apple stepped forward with a partnership, a framework of technology that would enable it to work on a decentralized model. There are some problems with that because you need a suitably advanced smartphone. And certainly here in Scotland, we had complaints that, you know, I have an iPhone something, I can't use the app, what about me? But once if you have the technology, I think all apps these days that I know about are using the Google Apple framework. I'm not aware of any government anywhere outside Asia who've managed to make it work without the American support, basically.
That's really interesting. Andrew, thank you. I'm just going to invite Zav and Yasmin to join us. Zav, there's been, it probably tells you something about the nature of the circus, that oh, there he is. We've got his chair, but not Zav. Poor man. That's the cruelty, Tom. That's a very cruel trick to pull on a poor man. I was only saying this morning about Zav, I should just say something fair to all those people who possibly don't know him, is that we've been really focused on trying to develop for our thinkings these 5-slide guides, which try and distill a lot of the data and information. And between Zav and Ella Hill and Luke Bedimer and a few others, they've been kind of working all the hours of the day. So Zav might well have just collapsed under that desk. Zav, you're going to love this. You're being invited in on this conversation. There he is, just returning to his desk, poor man. Zav, can you just, I was just asking about the point you were making, which I didn't quite understand, which was that the Test and Trace app, it seemed, had penalized someone for going along to test, and if I understood correct, negatively test someone for COVID. So will you just talk us through that story, just so I understand exactly what happened?
Yeah, so my uncle's kid had COVID symptoms. They booked a test. They self-isolated for a few days, so the uncle didn't leave the house at all, come in contact with anyone else. They went to the testing center. They got the test kind of processed. The kid tested negative, but around the same time, the uncle, who had the NHS app and clearly hadn't turned the Bluetooth off when he went into the testing center, because obviously you just might not remember to do so. He got a notification on his app saying he had to self-isolate, and by the fact that he had not, come in contact with another soul for a week, he's reasoned that he was given a notification to self-isolate because he was in a car next to someone else who was getting tested for coronavirus, who obviously later tested positive. And he told. Sorry, Karen?
Does Test and Trace not tell you the occasion or the likely person that has required you to self-isolate?
No, I don't think so. And he told the school where he teaches, and they call Public Health England, and because schools have to be very careful, he was told he has to isolate for another week after having isolated for a week already. And there's a similar problem in NHS hospitals as well, where NHS doctors are told to turn their Bluetooth off when they go into the hospital, so that it doesn't get triggered by them dealing with COVID patients. But the problem with that is then you might not get the notification if you bump into a colleague in a cafe when you've not got your PPE on who has COVID. And so there's flaws in the system.
Wow, that's quite a big flaw given the number of people working in the NHS.
Yeah.
I'm going to bring a couple more people in. Zav, thanks so much. Yasmin Abdulmajid, Yasmin, you made a point which was about the fine system and people who are being pursued for fines and people who aren't. Will you just talk us through that story? What happened? If you're there. Yasmin, are you there? No, you're not. If you're not, then I'm going to just go straight to Lucy Huberman, because I wanted to pick up on a point, Lucy, you were making.
Yes.
Hello, Lucy. You actually made a few. One was about where you were seeing the largest infection rates, but also others were about the kind of disjointed nature of the app. So tell us what you think we should look at on this.
I think I'm hoping the app in England is sorted. I know there are people who've got concerns about their privacy and about surveillance, but to the best of my knowledge, and there are other people on here, it doesn't collect any data. It's just pinging through the testing system. So if you are near somebody who's tested positive, you'll get a ping. But it's not collecting big data about you. I mean, there are huge issues to do with our health data, but they're not this issue. So I think I use the Zoe app because I'm contributing to research, and I use now the NHS, well, whoever designed the NHS app for contact tracing. You can turn it off. You do have to remember, it's not very difficult. You can turn it off.
You're not worried about the data.
No.
Oversight of your data.
I'm terribly worried about data, but not to do with this app.
Okay, yeah, it's
for another day. I mean, they're big worries.
I think they are big worries. So you're right. We'll do that on another day. I'm just going to invite Chris Chadwick to make a point, because I can see he also. But I think Chris may be more worried than you are. It's probably more like me. I am a little worried about it. Chris, are you there? No, I can't see. Oh, is Chris there? Chris Chadwick, you there?
Yeah, I'm here. Can you hear me?
Yeah, I can hear you. Are you? Lucy makes the point that actually there are big data worries in life, but possibly not necessarily focused around this app. What do you think?
Well, I think, I agree with Lucy. I don't think that the app will be necessarily identifying individuals and collecting individual data. But the thing to remember about all data is it's interconnected. Yeah. And so, if it pings a base station, then triangulation of that base station means that you can identify where people are. Now, the important thing is where does that data live long term? And if people get a hold of it, how can they join the dots? So it's more about, a kind of responsibility issue about who's looking at these issues at a kind of governmental level. How do we manage on long-term data? It's a bit like archives in the old paper-based systems, and stuff got put into boxes, and then boxes were archived in some room. And it's 20 years later when somebody unearths that box and starts to do the digging and join the dots. Of course, now we've got artificial intelligence systems that will be able to join those dots much more quickly. So if people can grab that data, bad actors who find it, the WikiLeaks type scenarios, we have a big issue about how do we control that stuff.
Okay.
I don't have any answers, but I'm just highlighting some of the issues.
You've prompted Nico McDonald just to make a point about taking that forward as a story. Nico, do you want to just talk through how if you were going to pursue that, you think you would?
The government digital service story. Yeah. I interview lots and lots of people, quite a few of whom I know. You look at what was happening in the coalition at the time, talk to Francis Maude and various civil servants who might have been behind it. Look at its track record, try and evaluate what, where it's achieved things and where it hasn't. Look at some of the challenges it had, particularly with HMRC, and some of the successes with Department of Justice and other areas, and look at the kind of trajectory.
Nico, forgive me. What is the sort of simple version, if there is a simple version of it? I mean, do we look back and say, actually, that was the right initiative at the right time? That was. Well, tell me what you think. I mean, if you were sitting in judgment of it, what would be your view?
Yeah, I think it was a pretty remarkable thing. Yeah, I think government managed to create a unified, more or less, way of interfacing with government, which worked very well and was quite British in a way, which I won't explain now. And my sense is was pretty successful. And given it was under a coalition, not least, I think that's particularly remarkable. And I can't think of another country which has been so effective in pulling together government under, on the web, if you like. Although, I don't have exhaustive research.
Yeah. Okay, Nico, thank you. That's really interesting. I mean,
welcome.
I should say this is not a casual exercise, and the things that you say and that Andrew says and Lucy and Chris and all were just saying is really helpful to us, because we're trying to pull together next week's file, taking a look at test and trace as a simple exercise in government, and why, not just for political reasons, but considerably for political reasons, this country seems to have struggled so significantly, and all the knock-on effects of that. So these kinds of suggestions are hugely helpful. I'm going to. I said I was going to come back to my colleague Kerry. I just want to make a point about one element of the test and trace thing, which I think is significant. Is that Andrew, you talked about how many people are downloading and then using the app. One of the things that's striking to me is the level of financial support if you are asked to self-isolate, and what happens if you're on a contract, what happens if all you're going to get is statutory sick pay, and some of the questions that arise for me around the Boris Johnson's position are now increasingly economic as well as health, and there seems to be a lag in terms of public perception about Rishi Sunak and the extent of support he's given. Not for the 3 million excluded from the original schemes, not for people who are necessarily isolating, not for people in sectors of the economy where they've seen demand disappear. And I just wondered, Kerry, whether you would sort of pick us back up from the conversation last night on the point Matt was making at the beginning about, red wall versus Johnson Tories, or Shire Tories, if you like, and some of the sort of building pressures that are now students, test and trace, economics, and then the rising worries that are core healthcare provision worries, and how you think all of that visits upon Johnson and the government.
Actually, there are a number of people here today who were thinking last night, so they may want to join in as well. And I think I'm just looking at, since we started this conversation, James, I'm just looking at the tweet that Boris Johnson has sent, which says, "Apologies, I misspoke today," and then goes on to explain why, yet again, he's failed to understand the rules of lockdown, and he completely got around his neck how the rules apply in the North East. So this goes on, basically. That sort of veneer of incompetence that is so firmly attached to the government seems as well attached as ever. And I think we talk a lot when we talk about COVID about what it changes and what it reveals. And I think what I sort of thought by the end of yesterday's thinking was that perhaps what's interesting about Boris Johnson is I think it both changes and reveals. Because I think if you start with what it reveals stuff that we already knew to a large extent about the grip, the lack of attention to detail, hence the tweet today. And it also reveals, I think, that he is instinctively more interested in executive power than in Parliament, and we're seeing that play out. But at the same time, particularly his own experience of COVID, I think feels as if it has changed him. I think when the public inquiry is done, and we may have something more to say about that next week ourselves, I know, the speech that Boris Johnson gave in Greenwich in February, I think, will be a really important early piece of evidence. So people will remember it. If you take that as sort of Boris Johnson's kind of natural position before he got ill, and he talks about this bizarre autarkic rhetoric. He talks about the risk that COVID will trigger panic beyond what is medically necessary and do real economic damage. And he talks about the UK as this sort of Clark, it's very Johnson sort of metaphor. The UK will be a sort of Clark Kent nation that goes into their phone box and emerges with its cloak just to save the global economy. That Boris Johnson, I think, had a kind of natural constituency within the Tory party, but he's moved now, and I'm not sure that he has got the same sort of solid base that he had. And at the beginning, James, you talked about, him as he was elected leader by his colleagues because he was a winner, and even those who had doubts about him, held their noses in some cases and voted for him because they thought he could win. He duly did. But I think if I think about the three sort of qualities of Boris Johnson, he's a winner, he's an optimist, and he's, as you saw in that Greenwich speech, essentially a libertarian. And each of those things seems really difficult to me in a pandemic. It's hard to be a winner. It's not easy times to be optimistic, and he's no longer libertarian in the same way that he was. And particularly with these sort of darker days ahead on the economy and unemployment, things for him to be able to regain his mojo on those three fronts feels really difficult. And when you think about what might allow him to return to his sort of natural form, then it feels dangerously for him as if it hinges really on a vaccine. And for him, that feels like quite a sort of slender thread, I think, to hang a career from.
Yeah, it's interesting. So I know, but Kerry and I have been having these conversations back and forth for what it's worth about vaccines. I'm much more worried about public confidence in a vaccine when it rolls out, because people asking themselves, is the phase 3 trial sufficient? Are we fearful that the process has been rushed? Are the politicians and regulators eager to see a vaccine sign off? And what happens when healthy people are asked to have an injection, and how wary will they be? Kerry's view, for what it's worth, everyone, is that I'm in danger of becoming one of these science-denying,
It's an emotional maniac was the phrase I used.
I think that's exactly it. Well, listen, we will revisit that point, because I do think the what's happening with the failure in test and trace, with the problems in the economy, with what's happening in terms of willingness of people actually to access healthcare services, is that more and more is being freighted in terms of expectations on the vaccine. So I think we're going to have to come back to that. I know Giles Whittell did a great job early in this talking about vaccine. We'll come back. As I said, we're going to wind up today at 5:02. I'm going to just pull together 3 observations. One is, please do take a look, as I said, at my colleague Claudia Williams' file this week that sets out to look at the fertility industry. It starts, I hope, in a spirit that looks at the extraordinary contribution that IVF has made to our world. More than 8 million people brought into the world thanks to IVF. The joy of that is immeasurable. But also, how do you understand the emotional exploitation, the financial opportunism, the ethical nonchalance of fertility industry? We look at that through the course of the week. It's a really serious piece of investigative reporting, but also I think, considered coverage of the subject. The second is, we're really focused this week on what's happening in the United States. You'll have seen yesterday the analysis from Giles Whittell on the New York Times release on taxes, today from Chris Cook on what looks likely in terms of polling, and tomorrow we're going to have the post-debate discussion. So please do join us for tomorrow evening's thinking. A lot of work's going into that. And then just to let you know, we will take away from this conversation elements that will drive, I hope, our reporting into test and trace, into the question about who is and isn't going to hospital when they need to. And I did pick up in the chat the note that says there's an element here that's about competence, but there's also about accepted corruption in government. I will make a point of coming back to that too. So with that, thank you everyone for joining us. Enjoy your 4 free minutes before the next 2 o'clock conversational call starts. Hope everyone has a very good day, and look forward to seeing you tomorrow evening's thinking on the US debates at 6:30 London time. Have a very good afternoon, everyone.